Welcome to the lABLEd podcast, a show about disability, illness and difference. I'm Lucy.
And I'm Alice. And that's Lola.
Kaleidoscope identity, and this is who I'm meant to be. I'm just labelled me. I'm just labelled me.
Hi guys! Don't forget, in this episode, I might swear, Lucy might cry, and you can check out details of the trigger warnings on our website.
Hello everybody and welcome to this very special bonus content we've got for you today. We are Alice and Lucy from the lABLEd podcast. We have been working in conjunction with Versus Arthritis to raise awareness of their campaign, The Painful Truth. So for this special bit of bonus content, we have got Jo Hemmings, who is a psychologist, who's going to talk to us about how the representation of chronic illnesses and pain, or lack of it, affects people's perceptions of what it's like to live with pain. So, hello, Jo.
Hello, hi, nice to meet you.
Nice to meet you too. Jo, would you like to explain a little bit more about the Versus Arthritis campaign, please?
So this Versus Arthritis campaign is really there to come up with some sort of document or suggestions for TV so that it makes it easy for them to be able to bring in more content and storylines about people who are suffering chronic pain, particularly from arthritis, but not solely arthritis, because it's just one of these very neglected areas of TV. I think they had a survey which was said out of 100 hours of TV, there were only 6 minutes actually referring to anybody in pain. And so I think what it means is that people who are suffering chronic pain feel misunderstood, they feel a bit stigmatized, they feel a bit left out, that they're not part of an everyday drama or a soap, whatever it may be, where, you know, there are so many people who do suffer, but they're just not represented, and that just makes them feel that they aren't, that it's not very inclusive. So they're coming up with a proposal to, you know, to help TV, if you like, to sort of pull these storylines into some of their programs.
I think that's a really progressive idea, to actually be saying, okay, instead of saying this is a problem, you need to fix it, actually kind of providing guidance on things that they can do, you know, because it is difficult, I think, for people outside of the disability community, people who don't experience, you know, chronic illness and pain, to kind of comprehend how it may impact a person's life. So I think actually, you know, offering some guidance and producing something that says this is what it's like and this is what you can do is, you know, it's a lot more useful than just kind of going, well, this isn't fair, why aren't you showing?
Yes, exactly right. And I think that's how they got to that point. And I think, you know, where some disabilities are reasonably well represented on TV, certainly cancer, you know, there's certain illnesses, mental health illnesses are quite well represented. The one thing, you know, that really, really isn't, is that constant. So it's not acute pain, which sometimes we see, but it's chronic pain, the sort of pain that literally dominates people's everyday lives. I mean, interestingly, Eamon Holmes have been talking about it because he's in chronic pain and he was, you know, really suffering from it, and he decided he would, you know, go on this morning and talk about it. And I sort of tweeted him, we sort of know each other from doing TV, and sort of promoted Versus Arthritis. You know, I said, look, you know, these are, and other people came back to me and supported, said Versus Arthritis were a great organisation, agreed that it wasn't well represented. And I think he's done quite a lot to open people's eyes. He retweeted me. So it got a lot of traction for them, which I think is important, because I think, again, when it's been on TV before, even if it has been part of a storyline, it's sort of almost neglected. It's just,
Yeah.
one of those things that, yeah, take a couple of painkillers or whatever. It's one of those things you've got to put up with, and people don't have much empathy towards it, and therefore not much understanding towards it.
So the thing that really sticks out for me there, Jo, is that when you're talking about the representation of chronic pain that either has been or, up until this point, it's either, you take a few tablets and then you're all right, or you go to the other nth degree of, I'm thinking about Izzy in Coronation Street. She's got a disability, and obviously as a result of that, they explored the chronic pain that she was in due to a disability, and she was trying to get hold of it. I think it was cannabis, and she got in trouble with the police and got into all sorts of trouble, and there was a threat of prison. So it's either really dramatic or I'll take a few tablets and I'll be absolutely fine. There's no sort of in between sort of how I really manage with this pain without threat of arrest.
Exactly that. So it's unhelpful for people, because that is what people have to do. They have to learn to manage their pain. And it's not to say they won't be taking painkillers, but there are other ways of learning to manage your pain, and seeing it, in a TV story just raises awareness. It always does. I mean, one of the reasons I wanted to get involved with them, Versus Arthritis, was because I have Crohn's disease. And one of the side effects of Crohn's disease can be really bad arthritic flare-ups. I mean, so bad, it would take me 20 minutes to get down the stairs on my bottom, because my feet and hands and ankles have swollen up so much. So even when I tell people I had that, they just think you're in a little bit of, you'll be hobbling a bit. I literally couldn't move. So I sort of, you don't want to sort of, I'm very lucky. It's not something I have to live with on a permanent basis. But when you get a flare up, you realize how extraordinarily different it does feel. And it's just one of those, yes, people sometimes do have to live with it. Sometimes there isn't anything that can be done medically, in any way with painkillers or psychology or whatever. And it is something they have to tolerate. But we need to know that as a nation. We need to be able to see that is how an awful lot of people live their lives. Doesn't mean they lose their sense of humor, doesn't mean they do something illegal, doesn't mean they have breaks from that pain. It's all about inclusivity, I think, and it's one of those areas that just is not covered properly.
And I think, in terms of the psychological impact that having that kind of representation has on people, I know as a disabled person myself, seeing other disabled people on TV and, out in the media, it makes you feel seen by society.
Oh, absolutely.
It makes you less of an alien when you go out in society. So, I can understand, particularly when chronic pain quite often comes alongside, with other invisible disabilities. Arthritis isn't always a very clear, visible issue for people. So having that space on something like a soap, or a TV series to explore the length and depth of the kind of issues that people with chronic pain experience, it's a missed opportunity for, an interesting piece of storytelling, as well as having that hugely potentially positive impact on this whole sort of community of people.
And it's also learning to accept it for yourself. It is that, exactly as you say, it's that feeling, if it is represented, there is a sort of reassurance in that. The other thing that they tend to do on TV when they do talk about the chronic pain from arthritis is only show really old people. And of course, there's a lot of younger people that have arthritis and do get extreme pain from it. Again, that would be really good to put in. It's not just an elderly person's condition. But we look at the stereotypes, unless those stereotypes are broken, and we see a look into a life that we may not know. We may not know anybody who has it, but when we see it, and particularly I think in a soap or in a drama, and it's given a positive viewpoint, people do get on with their lives. They do manage to do stuff. but they are in pain. Just getting that balance right, as you said, Lucy, so it's not one extreme or the other. If you want a bit of, illegal drugs, and you need it for your pain, ending up in a police station probably isn't hugely helpful to anybody.
No. I mean, I have cerebral palsy, and so I have a lot of pain because I sit still quite a lot, and so when I do move, it hurts because I've been sat still for so long. And the amount of times when I say, "Oh, I've got a bit of pain," and they'll go, "Oh, have you tried seated yoga or CBD oil?" Or and I'm like, "Yes, I've tried CBD, and it does work to a certain extent, but it doesn't. It's not like all of a sudden you take a CBD tablet and all of a sudden, no, I'm fine. I can bend, and it's quite." But I think as well, soaps have a. It's not like watching a panorama documentary, is it, about chronic pain, where it's very, these are the facts. With a soap, you've got the perfect opportunities, kitchen sink, this is what real life is like. You've got a perfect opportunity there to go, it's not all facts and figures, and it's not as daunting as it sounds. You can live a full life with chronic pain.
Soaps are the ideal platform because we're watching it and we're seeing whether it's a mixed race couple or whatever it is, things that just become automatically every day and acceptable, and you're not necessarily conscious of that, but it's getting into our heads, and so we don't look at people perhaps oddly or strangely because we're now used to it being part of our favorite long-running soap opera.
Because it's long-running, you quite often have that opportunity where I think a lot of dramas, you see a lot of films where the entire film is about a person's experience of X, whether it's, racial discrimination or coming out as LGBTQ plus, those sorts of things. With a soap opera, you have the opportunity, you can have, if you feel it necessary, to have that first arc of this is what this person's chronic pain is like, this is how much it rules their life, and then they can move on and have other life events and things that happen.
Absolutely.
But you've already made that groundwork, and you can still weave in the impact that it has.
I think it also encourages people to seek help.
Yeah.
I think it actually and it's been shown statistically that with anything like this, when people have had breast cancer, for example, on TV, that has increased the rate of people who have checked themselves, gone for mammograms. So we know that from other conditions that it has made people think and perhaps do something about it, where they may have just felt, it's just one of those things I have to tolerate. And I think it's really important that we get that message over without forcing it on people. It's implicit and it's just gently woven in. And as you say, Alice, having that person doing a job or whatever it is, having a love life, don't stigmatize them and put them out in a place where they can't have any of these things because they've got chronic pain. That would be even worse, because that's just going to kind of create a greater stigma around it.
And I think for me and Alice, I don't know whether I speak for you with this, Alice, but I think a lot of people who don't understand blindness or cerebral palsy or any kind of disability, they often think that we must be so sad because our lives must be lacking so much because we can't walk upstairs, or because, Alice can't read a book. Well, actually, Alice loves reading books, and and it doesn't really matter that I can't use stairs because it's not, to us, we've grown up with it. It's not a big deal.
Yes, absolutely.
So it's
right.
It's not all encompassing. We've learned to adapt our lives to, okay, I might not be able to read a book, but I can get a Kindle that's got different print sizes, that kind of thing.
I mean, thank goodness there are things like that.
Exactly.
I mean, it's like having Crohn's disease. I mean, if I know I'm going somewhere and I'm having a bit of a flare, I'll just have to chow down on a couple of Imodium. But if I can't, I do have a card that I carry around with me. But again, it feels a bit awkward using it. Going to the front of the queue, going, for your music festival or something back in the days when we used to have them. There would be times when you need to go to the loo and you can't wait 10, 15 minutes in line, and you've got to show this card. And I've always had people being respectful. No one's ever said anything. But again, I'd like a storyline built around people who have that sort of thing. I know we're talking chronic pain in this instance, but again, you don't hear about that, and it's, you know, like a lot of disabilities, it will never go. It can't be cured. I will live with it for the rest of my life. It has its moments, its bad moments, its good moments, and you know, these things are just not. They just need to be woven in in a clever and engaging and positive way.
I suppose that's the thing, is because ultimately disability is only ever one aspect of a person's life and experience.
Yes.
In terms of the sort of psychological impact of kind of that representation of, you know, and being seen and being your issues being portrayed and reflected in the media, can you sort of tell us a little bit about what the impact that has psychologically on people who aren't represented or who feel kind of underrepresented or wrongly represented?
Well, that's a good point, because they're both as bad as each other, really. It makes them feel marginalised. It makes them feel that, you know, unsupported, misunderstood, bit freakish. You know, I mean, if you're not there amongst the mix of people that we meet in everyday life, if you're, you know, they feel left out. It just makes them feel very marginalised, or that it's not significant enough or to be part of something. And I think in part it makes people put up with it when they don't have to. It also raises the idea that, you know, if they see other people and what they've done about it, they will do something else. I mean, I've spoken to a lot of people recently with chronic pain who, sad to say, seem to have been turned away quite a lot from hospitals and consultants who said, well, we can't do any more for you, we're not quite sure what it is or what we can do. And I'm going, go back and be persistent. You know, that just don't accept. You know, I know the NHS, bless them, I love them, I've worked for them, but you know, they've been very under pressure over this last year, and probably there are consultants who have said, yeah, you know, this isn't the right moment to be dealing with it because we've obviously got, you know, people dying around us. But that doesn't mean that when things level off a bit that they won't have more time for you. And I think that's really important for people to know, that this year has been difficult for anyone trying to see a medical practitioner on any level. So now we're hopefully, you know, coming to the end of this is the time to go back and say, no, I'm still in this pain. And you don't want to be on vast quantities of very addictive painkillers. The answer is not to say keep taking more. Because they in themselves psychologically, you know, that dependency, you're just swapping one issue for another, really. And I'm not against painkillers by any stretch. I'm against them when they're very strong and you're taking quietly, you know, more than you've been prescribed or for too long a time, because it's just masking symptoms that may have another way of sort of, you know, managing it.
And actually you're not very healthy at all, just because it's masking the pain, isn't it? Really, it's that kind of
well, it is, it's swapping a physical pain for a psychological one, basically.
I do have to take painkillers for my pain and things like that, but I don't like if they said like, oh, we'll give you a strong painkiller to help with your pain at night, for instance, so I can get some sleep. I don't want to be so medicated that I'm out of it the next day and not able to function.
Exactly.
So it's finding that right balance.
It's the balance. And a good consultant, a good doctor will do that for you. Will find that balance so you can sleep at night, but you don't feel groggy.
I think it must be really hard though, because, you know, when you're in pain, and I get sort of migraines, but my pain is I think it's a different kind of pain. You know, it can be absolutely all consuming. And so I can also, on the other side of it, understand that if somebody's saying to me, look, I can give you a drug that will knock you out and you just won't feel it. I can absolutely understand people who feel as though they have to fight, as you say, just to get down the stairs. You know, people who have to fight to get themselves from their bed to their commode or something, and that is all of their energy and it's a huge amount of pain. I can absolutely understand if somebody says to you, it will knock you out, but it will stop the pain. I can appreciate why people...
You get it, and I get it too. It's just, I suppose I don't want it to be so masked on such a long-term level that actually that means that people have got off lightly in the medical profession. They haven't really looked at another way your pain might be alleviated. Perhaps it's some sort of exercise or whatever it might be. But of course, I would never say to someone, you should suffer that pain, don't take a painkiller, because that would be, what would be the point? I'm just being cruel and unnecessary.
And I think, one of the things that would be good if you saw more representation in the media and things, is that it would give kind of characters the opportunity to explore these thoughts and feelings, and then the person sitting at home might then feel more able to sort of say, actually, I hadn't realized that. I hadn't been aware how much of an impact this was having on me. I hadn't known that there might be a middle point where I can take a medication that will help me sleep, but then I'm not so groggy the next day that I can go out and work or because whatever it might be.
I think there is a group in society who are in pain who are like, I don't want any medication at all because I don't want to be seen as quote unquote a pill popper, you know what I mean, constantly popping pills. Whereas if they see the representation of, no, if it's managed properly and you are, under the care of a consultant or a doctor or whoever it is who understands you, because they are out there. That you don't have to be a quote unquote pill popper. You're not constantly thinking, when's my next dose? Like swallow it.
Listening to that, like that, I'd watch Coronation Street for that story. That sounds really interesting. A person whose pain is perhaps progressing and they're exploring their different medications and they're finding that they found something that helps with their pain, but it's having an impact on other aspects of their lives. That sounds like ideal soap opera material to me.
It does, absolutely. And there should be characters like that in there who, because it shows people that there are a variety of ways of coping with it. There are devices you can get, things like TENS machines. You need to know about these things, and someone needs to tell you about them, and it might just work for you and it might not, and if not, try something else. It's probably at the end of the day for most people a combination of various types of exercise, possibly some sort of device, painkillers, reassurance, positivity, being able, having things in your home that make life easier for you to manage, adapting your environment to suit your needs. And you've got the best you can be with what might be a very long-term condition. And that's what I want to see on telly. I want to see people who've adjusted to it, who are not just neglected, or they have it in one episode. Continuity sometimes isn't great, and then the next minute they haven't got it anymore. Where did that go?
Oh yeah, it's like when people have strokes for a month, they've got like a fallen face on one side, and all of a sudden a month later they're absolutely fine, and you're like,
absolutely, yes, they were pre-stroke. There's no kind of like getting back to normal, and that, these things are really misleading because that's not what happens.
And I think to a certain extent it's quite lazy, because it's not like they've got like 6 episodes in a series and the series finishes and then that's it. A soap opera is on constantly, 3 times a week. It's not, they don't go, we're going to stop here for 6 months and we'll come back to it. They've got enough time to go, let's tell this story. And it's not like this.
Well, and it's interesting character development and stuff, isn't it?
And I think sometimes as well, actors forget them. They're meant to have a stroke, like I meant to have a stroke 6 weeks ago. I'm fine. It does make me laugh.
I read a thing with that Hugh Laurie said that after playing House for 6 or 8 years, he kept finding himself walking around with a limp and had to sort of go, I don't limp. I don't have this problem.
I'm fine. It's all right. I'll walk it off. It's all right. Jo, is there any evidence that shows that representation on television and in films and things like that for stuff like disabilities and chronic illnesses, that it not only helps the person who's got the disability or chronic illness, but it helps understanding for non-disabled people that, maybe would never ordinarily come into contact with a disabled person or somebody who's got chronic illness, maybe?
Yeah, I think so. It also helps people who actually do live with someone who's got chronic pain or who they know very well, perhaps a relative
Mm.
or another family member. And I think this trouble with anything that's chronic is it tends to be long term. And so you sort of don't want to make a thing of it. So you sort of push it to one side and you forget that that person is still struggling because it's been going on for a long, long time, and it's not something that needs urgent treatment or can be, you can't go in and have a quick op and come out and be skipping around the streets. So I think it helps people to be more aware and not to forget that this is a long-term thing for people, and just they don't ask about it after a while, obviously, because
No.
it's something that you live with, and it's not like, as I say, you can feel better in a few days. So I do think it's very useful. I mean, there've been a number of instances, not just in real life. I think when Jade Goody, for example, when she had tragically died with cervical cancer at a very young age, the amount of girls who went and had checks, it just, I can't emphasize enough how important it is if handled well. And that's the point of the Versus Arthritis sort of document they're providing for TV, is to make it as easy as possible for them to slipstream a well-managed character and storyline into their productions, so that they don't have to think, oh God, this sounds too complicated, and what do we do then? And we won't do it.
And also, it eliminates the awkward conversation with somebody who may have chronic pain or arthritis or whatever, to say, do you mind coming in and telling our story writers about what it's like to live with, because not everybody wants to go into a deep dive of, I'm in constant pain all the time, and highlighting things that they struggle with. Whereas if they've got this document, they can read it at their leisure, digest it, and then perhaps, once they're a bit more informed, say, can we just talk to you about your experiences with arthritis, so they don't have to drag up all the trauma. I mean, we've spoke to Jasmine for this sort of twin set of episodes, and she said, the trauma that she had from, all the medications and stuff, the colour yellow, she gets the taste of the medicine that she had as a kid in her mouth. So having to talk about all of that stuff to a complete stranger from Teleland,
it's very triggering. I know. It's very difficult.
So
I think it must be really hard for pain as well, because it's not something that is easily kind of communicated and explained to somebody outside of you. There's I mean,
it's because it's subjective. That's right. Exactly. It's not objective. So when people say, what pain are you feeling now on a scale of 1 to 10?
Oh, yeah.
Well, one person might say 10, another person might say 2. We don't know if that's down to their, I'm very, very highly pain tolerant. I don't want to let them know. I'm fearful if I say it's too much, then they'll want to try other stuff on me. So I'll either exaggerate it or I'll minimize it. And it's all subjective, and that's part of the problem. You hear people who are in chronic pain going, women saying to men, oh, you don't know what it's like, you tried childbirth, this sort of things. That sort of kind of diminishing their experience of pain, because it is so subjective. And I think that's a tough one for people to sort of to understand.
And I hate it where, when I have to go for medical appointments, and they'll ask me, whereabouts is your pain? And so I'm thinking where my pain is, and because I've got it all the time, I can't really pinpoint where my pain is. I just know it hurts.
Yeah.
And so you start questioning yourself, thinking, well, am I actually? Have I got pain, or is it in my head? Kind of thing. And I know I am in pain, but I can't exactly tell you where it is. I just know it hurts. So,
well, that's interesting. So when people say it's in your head, I mean, to a degree, it is in your head.
Yeah.
Because all pain is you've got brain receptors in your mind that tell you whether you're in pain or not. So if you touch a burning hot object, thankfully, we have those receptors that make your hand move away very, very quickly.
Yeah.
If we didn't have them, we'd burn our hands.
Yeah.
We wouldn't know when to stop. So they're there for a very good reason. So effectively, all pain is in the head. You know, it's just stupid. I hate that response to people.
Yeah.
Because it is to do with the receptors in your mind. But nevertheless, it's felt physically in one part, many parts of your body. And you can't deny that.
I mean, surely we all live inside our own heads. Everybody's experience of everything is filtered through the brain, and the mind and the experience.
It is, but if you break a leg, you can see the leg's broken.
Yeah.
You A, expect pain, and B, you can see a fracture snap. You can X-ray and see, that's, or whatever, or you can just see it. So there are things that are more visible, people are more tolerant about than things
Definitely.
that can't be seen.
I've definitely experienced that for myself. Am told on a regular basis that I don't look blind. And the difference in the way that I'm treated by society when I go outside with my guide dog as to the way that I was treated before I started using a guide dog. And actually, yes, my sight's changed probably more recently, but when I first got my dog, nearly 8 years ago now, my sight, the difference between, Wednesday when I didn't have the dog and the following Monday when I did, my sight hadn't changed dramatically, yet the way I was treated changed very noticeably.
In a good way, or just in a changed way?
Both sides of the coin, I'd say.
Yeah, I can see that. Yeah.
Definitely a lot. I am noticed much more, and people anticipate that I might need assistance and support. And people are more forgiving, I think, of, if I trip over something or knock into them or something like that. But I also get stared at and pointed at and have the same conversation with children over and over again about how she's a special dog. And it's fine.
But that's quite nice, I suppose, for kids to know that, how amazing, guide dogs are.
Yeah. And I will always have those conversations with kids. I think once you hit, if you're like in your mid-20s, I start to think this is not cute anymore. You can go and learn for yourself. Don't ask me questions in the street.
Yeah, I sort of agree. And it's just,
sometimes I do feel like having a laminated sheet of here's a frequently asked questions.
I know. Get yourself a little booklet and just hand them out. What questions are? I know I had a friend who is extremely slightly sighted, has really poor eyesight and uses the white stick. And you said people are always shoving her across roads. But she doesn't necessarily want to cross.
No.
She's sort of standing there for a second and saying, can I have it? And then they take you by the arm and you cross the road, but she didn't really want to cross. She'd only paused for a second.
I have literally stood on corners before and people have come up and taken my arm and gone, come on, it's safe to cross. I'm like, no, I'm meeting my husband. What are you doing?
I know, I don't want to cross. I'm just waiting for my coffee or whatever it is.
My husband sees me crossing the road with another man. He's going to think, what's going on here?
It's people just being kind, but I can understand how that gets a bit sort of like.
I get little kids. One of my favourite ones of all time. I walked past this little kid, and he was with his mum, and he looked at his mum, and he looked at me, and he said, "Mummy, is that woman a transformer?" I was like, "No, but that sounds pretty cool. I will use that." It is amazing.
I know parents get very embarrassed, don't they, when kids sort of say. That's what kids say, I mean, it's like their interpretation of it without the kind of, got to be really careful.
It just makes me feel very, very sad and I still see it now occasionally, not as bad as I used to, but you do get the odd parent who still will snatch their child away and go, come along, we don't talk to people like that. And you think, oh, God.
I can't believe that would still happen.
Yeah,
I can't believe.
And you think you're setting
the ignorance of people.
I know. This is another.
Or like you're infectious.
Yeah, like they're going to
like they get too close, they might catch cerebral palsy.
And that would be the thing is, if these parents were seeing people like Lucy on their TV screens, it just demystifies it a little bit, doesn't it? And makes it less of a, oh my God, what's wrong with that person? And you just kind of as human beings, we are usually we avoid the things we don't understand and that are different from what we know.
Because it's
but
scary, I suppose.
Yeah, I noticed that in the beginning of the pandemic, because I'm classified as clinically extremely vulnerable because of the drugs that I'm on to manage my Crohn's. Of course, I got a vaccine, both of my vaccines, by beginning of January. Hurrah. So they're all like 80 and I trot along, and they kept trying to get me in the NHS staff queue, and I'm going, no, it's it's because I'm CV. And I said it to a few people, and it's worked to my favour because I've been able to film certain things that I wouldn't have been able to if I hadn't had the vaccines. But people always say, oh, I'm so sorry.
Yeah.
Do you know what I mean? Like when you say I'm CV, oh, I'm so sorry to hear that. But like, I don't know, it just feels weird. I say it's fine. It's like, it's just one of those things, it doesn't define me.
I always love those reactions because I sort of want to go, oh, this is your fault, is it? Oh, well, there you go.
You can get yourself an argument like that. Should be thinking feisty one here. Yeah.
But no, I think it's a great thing that Versus Arthritis are doing something like this, because it just helps, doesn't it? Really, I mean, I am always really disheartened when you watch things like Holby City, for instance, and it's a hospital, and then it's like, spot, where's the wheelchair? Where's the
I know, they're so sanitized. I mean, for anyone who's ever been, I used to watch anyone who's ever been in an accident emergency ward,
oh god,
or department, it doesn't look anything like casualty.
Yeah, everybody's respectful,
like,
nobody's drunk.
I was going to say, where are all the drunk people being escorted out? That's what I'm looking for.
Yeah.
I guess
anything that helps, boost about. I mean, all we're asking is for an accurate. We don't want like television screens to be full of people with chronic illnesses, so so that's all you ever see.
No, exactly. I think Eamon Holmes did a good job actually admitting his and saying it, and still waiting to hear, as far as I know, diagnosis. But I really saw people pouring out on Twitter, sharing their sort of stories, and that's always a good start. The feeling you can say it, and just it resonates, and other people can say it, and that's getting to a point where you don't feel you've got to keep it yourself any longer. That's always a good start.
Do you think as well, Jo, there is still this stigma around chronic pain and things like that, where people are afraid to say, I am in pain and things? So when somebody like who is well known and recognizable like Eamon Holmes goes, I've got chronic pain and I'm not afraid to tell you about it, then other people go, oh, yeah, I've got it too, actually.
Exactly that. Yeah, exactly that.
Yeah.
It's sort of something I've just had to put up with. And for someone like him who's, some people don't want to say it, they're frightened of losing their jobs or whatever it might be. I mean, he clearly has been in extraordinary pain, and then he decided, right, I've got a TV vehicle, a daytime TV show that I can present this on and get people talking about it. And I'm sorry for Eamon feeling the way that he does, but at the same time, I think he's got a lot of people, huge numbers of people, to feel included, feel understood, to feel that it can happen to anybody as well. It's
Jo, in terms of kind of psychological well-being and mental health, what would your advice as a psychologist be to anybody who is feeling excluded or isolated because of their chronic pain? What would you want to say to those people out there who might be listening now and who saw Eamon's sort of coming out story? And
I think first of all, I'd say share it. Like tell people what's going on. Don't think you've got to suffer in silence. Secondly, do get medical help. Get a good advice. Don't be fobbed off. Make sure that perhaps you are referred to a consultant. You can find out what it is. It took 3.5 years to find out, or 2.5 years, I think, for me to have Crohn's disease, because I had it in later life. Usually people get it in their 20s. I got it in my 40s. So they just dismissed it. Well, it can't be Crohn's because you're too old to develop Crohn's.
It's the opposite of what happened to Jasmine, where they said, well, it can't be arthritis because she was a child.
Yeah, exactly. So it's an uphill struggle if you don't fit the stereotype to actually get diagnosed. So I would say persist with it. Look at all your options. What do people recommend? Are there things you can do for yourself? Are there things, even down to things like mattresses in your home? Should you be having a firm mattress or a softer mattress? Whatever it is, do whatever you can to help yourself. Find out as much as you can. Tell people what it's like. Go and seek advice. Share it. Go on forums. Talk to others. Amazing what comes out of these things. Things you didn't even think about that someone suggests that just might work for you. And so that you get into a position where you are, knowledge is power. You will be able to manage your chronic pain the best way that you can as an individual. And that's leading your best life, really.
Yeah. And that mention of forums, actually, it makes me think of the No End in Sight Void hashtag on Twitter, NEIS Void on Twitter. And that is a place for people with chronic illness and chronic pain to share experiences, ask for help, ask for advice. And that's a really welcoming community. So I would encourage anybody who's listening who does think perhaps, they may have undiagnosed chronic illness, or they want some support or some advice about managing their pain and sort of their lives, then check out the No End in Sight Void. Jo, where can our listeners go to find out more about the Versus Arthritis campaign?
Very good question, Alice. They can go to versusarthritis.org.
Fantastic. Jo, I take it you're on Twitter as well. Where can our listeners find you?
I'm on Twitter. I'm on @TV Psychologist. So I'm very active on Twitter. It's the only one I am active on because I can't cope with more than one social media platform at a time.
That's great. Well, our podcast will be following you imminently once we've fired up the Twitter.
I shall be retweeting it if you tell me when it's on.
Fantastic.
I shall be sending it out there.
We definitely will. This afternoon, Jo, has been a little pep talk for me and my my pain. Come on, you can do it. You can do it. So thank you so much.
Oh, that's nice.
It's been a lovely afternoon.
Thank you so much for having me on.
Yeah.
Thank you.
Thank you so much, Jo.
Thank you.
Cheers.
Bye.
Bye. Bye.
Thanks for listening to the lABLEd podcast. If you like the show, please rate, review and subscribe. You can follow us on social media @lABLEd podcast.
Our thanks go to our editor Adam Hall, our music composer Maisie Crunden, and our graphic designer Sarah Coley.
We'll see you next time.